Ultra-processed foods, UPFs, have quietly become the backbone of modern diets. Convenient, cheap, shelf-stable, and heavily marketed. But their rise has come at a serious cost to global health, contributing to obesity, type 2 diabetes, cardiovascular disease, and metabolic dysfunction. As scientific consensus strengthens around the harms of UPFs, public health officials and governments are faced with a pressing question. How can policy intervene to reduce consumption and shift populations back toward whole, minimally processed foods? The answer lies not in a single solution, but in a comprehensive strategy that aligns taxation, regulation, education, and food system reform. One of the most immediate tools available to policymakers is fiscal policy, specifically taxes on UPFs or their components. Sugar-sweetened beverage taxes have already shown measurable success in countries like Mexico, the UK, and South Africa, where they've led to reductions in soda purchases and, in some cases, improved health outcomes. Expanding this model to include other hyperpalatable, low-nutrient foods like packaged snacks, sweetened breakfast cereals, and processed meats could further curb demand while generating revenue for public health initiatives. Critics may argue that such taxes are regressive, but the health burden of diet-related disease is even more so. Revenues from these taxes can be earmarked to fund nutrition programs in underserved communities, offsetting equity concerns. Clear, truthful food labeling is another low-cost, high-impact intervention. Current labels often obscure more than they reveal, with vague health claims and fine-print ingredient lists that most consumers find difficult to interpret. Governments can require front-of-pack warning labels for high levels of added sugars, salt, or saturated fats, modeled after Chile's successful black stop sign system. Such visual cues have been shown to reduce purchase intent, especially among parents and children. Labels that also denote levels of processing, not just macronutrient content, would help people distinguish between whole and industrially altered foods, shifting attention from calorie counting to food quality. Advertising regulation is another crucial piece. UPFs are often aggressively marketed to children, creating brand loyalty and emotional attachments before they can even read a nutrition label. Restricting junk food ads during children's television hours on school grounds and across digital platforms can limit this exposure and reduce demand. Countries like the UK and Brazil have begun moving in this direction, setting important precedents. Beyond children, adults too are vulnerable to manipulation through health washing claims and celebrity endorsements. Tighter controls on these tactics, such as banning terms like guilt-free, light, or natural when not scientifically justified, can help curb misleading impressions. Reforming institutional food environments is equally essential. Schools, hospitals, and government offices should be models for nutritious, minimally processed diets. Replacing UPFs in school lunches with fresh fruits, vegetables, legumes, and whole grains not only improves children's health, but also reshapes their taste preferences for life. Procurement policies can prioritize local and sustainable food sources, supporting farmers while enhancing diet quality. In hospitals, meals should reflect the nutritional advice given by healthcare providers, reinforcing food as a cornerstone of healing rather than an afterthought. Education campaigns can support these changes, but information alone is rarely enough. While raising awareness about the risks of UPFs and the benefits of whole foods is important, structural changes must make healthier choices easier, cheaper, and more accessible. That's where subsidies come in. Governments routinely subsidize crops like corn and soy, which are turned into cheap additives for processed foods. Redirecting some of these subsidies toward fruit and vegetable production, or offering incentive programs for stores to stock fresh foods in underserved areas, can rebalance food economics in favor of health. Urban planning and zoning laws also offer opportunities to curb UPF consumption. Limiting the density of fast food outlets in low-income neighborhoods and offering incentives for farmers markets or community grocers to operate in these areas can reshape food access on a neighborhood level. Similarly, policies that encourage home cooking, such as tax credits for kitchen equipment, community cooking classes, or paid family meal time, can slowly shift food culture away from ultra-processed convenience and back toward fresh preparation. Importantly, none of these policies exist in a vacuum. The most effective public health strategies are those that act synergistically. Taxes work better when paired with subsidies. Labeling is more impactful when supported by education. Advertising restrictions have broader reach when schools and hospitals reinforce the same values. Each intervention helps to reshape the broader food environment, nudging individuals, families, and entire cultures toward healthier default choices. In the end, reducing UPF consumption through public policy is not about restricting freedom. It's about creating an environment where making the healthy choice is no longer the hard choice. Governments have both the authority and the responsibility to protect public health, especially when the commercial food landscape is designed to undermine it. With coordinated, evidence-based action, policymakers can help reverse the rise of diet-related disease and rebuild food systems that nourish rather than exploit.